The heart has 4 chambers. Imagine them as connecting private chambers within a stately manor. In that stately manner, people enter and exit each chamber through doors. In the heart, blood cells enter and exit the chambers through valves. One such valve is the aortic valve, which connects the aortic artery and the left ventricle, the largest chamber of the heart. Over time, the doors in that stately manner can become creaky, stiff doors that don't open and close smoothly. Guess what? That can happen in the heart too. When it happens to the aortic valve, it's called aortic stenosis.
As it has tremendous trouble opening as we age, in a modest percentage of people, it may be difficult for the heart to get the blood to the body. And one can get short of breath, one could faint, one could get chest pain from the heart squeezing too hard to get the blood out.
While doctors can prescribe medications to mediate the symptoms, there are no medications that cure the stiff valve itself. And a few dabs of oil won't fix this problem. The only way to fix the stiff valve is with surgery.
So for many years, we've had the ability to give you a new valve, traditional aortic valve replacement, open heart surgery. In very recent times, there's been some extremely exciting breakthroughs in modern science. The ability to change the aortic valve without opening your chest and having traditional open heart surgery.
We can now insert a new aortic valve through an access point. The surgeon makes a small incision in the groin. He inserts a catheter and threads it through the body's blood vessels. The surgeon watches the catheter's journey towards the heart with X-ray imaging.
The valve is collapsed at the tip of a catheter, and when the catheter goes through our groin, around the aorta, the main blood vessel of the heart, they try to sneak it through the calcified aortic valve, make sure it's in the right position, and then like an umbrella, they expand and open up the valve to crush the old valve to some extent and implant this new permanent valve that will then start opening and closing and allowing an instantaneous improvement in blood supply. And it's been done in a very advanced older population with remarkable safety so far.
This procedure is currently only FDA approved for patients in their late 80s and 90s. These patients are often not good candidates for open heart surgery, but are excellent candidates for this.
This new exciting technology has in fact almost revolutionized the lives of older people and been able to make them much healthier at a minimum of risk and avoid traditional open heart surgery. But sometimes as we're older or have other medical problems, such as bad lung disease or even cancer or kidney problems, that surgery becomes too high a risk. And for patients because of age or other medical problems where the surgical risk is too high, these catheters put in through the groin avoid the trauma and additional risk of open heart surgery. As the data continues to grow and it becomes safer and we have some track record in the advanced older population, if 90-year-olds can do well and we show that 2, 3, 5 years out that this is a safe new technology, then younger people will also say, hey, I'm not in a rush for somebody to crack my chest. Maybe I'll consider just doing it through the groin.
Then you can spend your time admiring the creaky doors in stately manners rather than worrying about the condition of your own creaky valve doors. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.